How you doing, sir? Good, good. I'm good. I'm glad I see you today, and I wanted to go over everything that we were able to find out. Last time when you came in, we had your treatment, we looked at your exams, and I just want to let you know what we found, okay? Perfect. So first, I just want to go into your history. I want to make sure that we get everything down before we go into exactly what it is that we found. Is that okay? Great. All right, so I see that you're a landscaper. I remember us talking about this last time. You know, feeling a lot, doing a lot outside, working in the yards, lifting a lot of manual labor, completely understandable. And it looks like you came to us because you are having some shoulder pain on the right side, more in the back area of the shoulder. I know you said that you felt this while you were lifting a log, and you lift a lot of different things. You're normally used to being sore, but this is just something that's been kind of bothering you a lot more than you used to. Okay, understandable. Um, Now, with that pain being right back here, you were saying that sometimes doing overhead motions or trying to bring your arms above your head, putting on a shirt, or even showering sometimes can just be uncomfortable. Okay, we want to make sure we have that understood. And then also, it's looking like you're feeling it, that's kind of in the neck as well. Just, okay, great. All right. Well, everything that I'm hearing right now, honestly, doesn't sound bad. It sounds like pretty normal things that happen as we age, right? A lot of things, as we age, we don't recover the same. Things just become a little bit different. So I don't want you to think that what's going on with you is out of the norm. All right. I know that you were also saying that you went to go see your orthopedic surgeon, and you had some imaging that you were going to bring to us, and it was something about like a partial thickness tear, right? Perfect. Whenever you get those images to us, we'll be able to look at that. And honestly, it actually helps us a lot more in being able to tell you what we found. Okay? Great. And so it looks like right now, the only things that you're doing to give you a little bit of relief is you're taking a little bit of over-the-counter medication, some anti-inflammatories or ibuprofen, right? Great. Okay. That's awesome. And then also, it seems that rest really helps you feel a lot better, right? I see somewhere here that you were talking about the way that you're sleeping can sometimes aggravate your shoulder a little bit. Understandable. Okay. So, well, let me just tell you exactly what it is that we found, and then we can go from there. I'll tell you how we want to treat you and all the options that we have available. All right? Perfect. So right now, it's looking like we're dealing with something going on with the rotator cuff. This is a blanket term. We always talk about the rotator cuff. People hear this all the time, but there's actually multiple muscles that are all working together just to help your shoulder have a little bit more stability, right? One of those muscles is actually right where you're feeling that pain right now. It's in the back part of that shoulder, and it's called the supraspinatus, right? A lot of, technical words, but I just want you to know that there's a muscle that's dealing with your shoulder right back here that we're thinking you might have potentially just worn out a little bit. Like I said, as we age, things just take a little bit longer to heal and to recover. So it could be just a partial tear, right? Now, I don't want you to worry. Like I said, this is something that happens with all of us. It's very normal. And I know you've been sore in the past. So with us, we're going to try to do some treatment more conservative. I know you were really worried about getting surgery. So what we're going to be trying to do is going to be trying to avoid that. So that way you get that care that you're looking for, okay? The way that I'm seeing it, we're gonna be having you in here for about 3 times a week for 4 weeks, right? We wanna make sure that we're getting you in as much as possible to give you that care, so that way we can get you back to work and back out there, because I know that's really important to you, all right? Of course. Now, if you weren't to see the treatment working, or if it's not benefiting you in the way that you need, after 4 weeks, what we would do is we would reassess. You and me together, we would see just where you're at versus where you came in at. And if we would need to, we would change the treatment plan, or we would bring in another doctor or another specialist to be able to work with us to make sure that you're getting the care that you need. All right? Perfect, perfect. Now, like I said, with this treatment, there's always gonna be pros and cons. So for us, the things that I really wanna do for you is obviously we're gonna do some chiropractic care. That will be adjustments, helping you with your, stability, helping you with your shoulder, and also helping you with your neck. With this, there's always going to be pros and cons. Some of the cons can be fractures, bruising, a little bit of tenderness after the adjustments, right? In rare cases, you could see, like I was saying, fractures or stroke. In some instances, you could see something that's called a vertebral artery dissection. All these things are very rare, but I always want to bring them up to my patients just so you're aware, okay? Also, on the other side, there are cons to not getting treatment, right? Cons could be that this condition could get worse, right? And we want to make sure that we're getting you back out there feeling as good as you can, okay? So there's always going to be pros and cons, but like I said, after 4 weeks, we'll reassess, see exactly where you're at, and if need be, make additional changes to get you to where you want to go, okay? Perfect. And then last time that you were here, you were telling me, I know that you said you weren't pretty sure about how chiropractic could help. Well, I just want to let you know, I actually have some articles for you. I'm going to be sending them over to you, right? And they're going to be showing you about how we have different techniques and tools that could help you even with this pain that you're having in your shoulder. Like I said, it's completely normal. And the things that we're thinking about doing are some exercises to help strengthen up the other muscles around there, to help share some of that load, give a little bit more relief to that area, okay? Another thing that we're thinking about doing or wanting to do is, it's called low-level laser, right? It's a technique that should help you reduce pain and also improve just your everyday function, okay? I'm going to send you those articles so that way you can look at that and you'll be able to see the amount of people that have been able to be helped with this, right? And we'll be able to do that here with chiropractic along with the adjustments to make sure that you're feeling better, getting you back to work, okay? Well, I'm just so happy that you came in. I'm happy that your wife talked you in, right? But like I said, we're going to make sure that we get you better. And if there's any questions, please let me know. All right. Thank you.